Hi, today I'm here with Katie McGinnis, and we're going to talk about the country of Uganda. You recently went to Uganda, and there was one area that really touched your heart. Why don't you tell us about that area?
So in Uganda, there is a very small rural town called Pallisa, and it's made up of about 30,000 people total, and it's kind of structured around these little villages of small grass or mud huts, 5 to 6 per kind of little village, and it's very rural. There's no transportation really available, except for if you're wealthy enough to have a bicycle. And there's no electricity. I think only 0.37% of the whole town has any kind of electricity.
Wow.
So the sanitation is very poor. There's very few pit latrines available. There's few water points available for clean water sources. And the healthcare is also very poor in the area.
So because of that poor health care, and obviously being in the rural area that they are, obviously health care is a major need there.
Yes, it is a major need. Only a very small percentage of women have babies in a healthcare facility. Most of them give birth on the floor of their grass huts.
Great need for immunizations.
Yes, huge need for immunizations. The diseases like polio and measles and mumps that we've eradicated here are rampant there, and kids die every day from them, which was really heartbreaking to see. Most of the kids I met in Pallisa have yellow eyes, which is a good indicator that they have pretty significantly advanced malaria, which was really hard to see. About 10% of the population has HIV or AIDS, so a lot of kids are born to mothers with AIDS, and because there's no health care, they have the disease passed along to them. And so just some heartbreaking things. It was really hard to watch. There's kids everywhere because over half the country of Uganda is under age 15, and Uganda also has 2.7 million orphans, which is more orphans than any country in the world.
So obviously this great need for health care, but in that community is a really strong church.
Yes.
And one of the things that they're working on is a health clinic for that area.
Yes, they started construction. It's called the Kerith Health Center, or Kerith Community Health Center, and it's tied to the River of God Church in Pallisa, headed by Pastor Samuel Musega. And they started construction a few months ago, and it's progressing fairly well, but they need more funding to finish the construction. And the cool thing is the government's going to provide the salaries of the healthcare workers who are actually going to be members of the church, who are nurses and doctors who have agreed to work there.
And the government's providing immunizations from what you've told me.
They'll provide a refrigerator.
So besides help in funding to finish the construction, what are some of the other needs that they're going to have?
So the things the government won't provide are things like bandages and Neosporin and children's Tylenol and adult Advil and things like that, gauze, sponges. Your basic medical supplies are things that we're going to have to find money for.
So basically the basic medical supplies that we take for granted, being able to go to the grocery store or to the local kind of clinic and picking up. If you've heard this and you're really touched by this story and you're saying, Victoria, I really want to hear more about Uganda. I want to find out how I can help with this project. I just invite you to contact World Missionary Evangelism today, www.wme.org.